Okay, thank you so much, Seh. So, as most of you knows me, but still I want to introduce myself. I'm Sehrish Tofique. I'm the project manager for the cross project from Pakistan. And in today's session, I'll briefly talk about our initiative that we did in Pakistan, Heartbeat of Pakistan, which is basically an awareness campaign that was run across Pakistan. Um, I'm sure almost everyone in this session is aware smoking is harmful. Physical inactivity increase the risk of heart disease, and eating a healthy diet can prevent many chronic illnesses. Yet, despite this knowledge, we all know cardiovascular disease continues to be the leading cause of death worldwide, and its burden is increasing rapidly in low and middle income countries such as Pakistan and Bangladesh. This raises an important question like, if people already know these facts, why do unhealthy behavior continue? Why do many individuals delay seeking treatment? Why do patients fail to attend um, like cardiac rehabilitation services? The main reason behind all these things is that alone is really enough to change behavior. People also need motivation, confidence, support, and awareness campaign begins and become extremely important. Today, I will first discuss what awareness campaign are, why such initiatives are important in context of public health and research, and then I'll share briefly like how we translated these principles into practice through Heartbeat of Pakistan Roadshow. Next slide, Seher. Okay, thank you. Awareness campaign. I'm on awareness campaign slide. Uh, so when we talk about awareness campaign, before discussing our roadshow, let's first understand what actually we mean by awareness campaign. Many people assume that awareness simply means giving a lecture, distributing some brochures, information leaflets, or posting information on social media or in print media. However, awareness campaigns are much more than isolated educational activities. They are carefully planned communication strategies designed to inform, educate, or motivate people to adapt healthier behaviors. According to the World Health Organization, awareness raising activities basically is a key component of health promotion. It involves providing accurate and evidence-based information to improve people's knowledge, influence their attitudes and beliefs, and ultimately encourage positive behavioral change. Therefore, awareness is not the final objective, it is the first step in a much larger process of improving health outcomes. For example, if we tell people like high blood pressure increases the risk of heart attack or stroke, we may have increased their awareness. But if that information encourages them to monitor their like routine or reduce or opt some healthy behaviors or visit regular like healthcare facilities, then we have achieved behavior change. So a successful awareness campaign therefore requires much more than information. It usually begins by identifying a health problem, understanding the need of the target audience, developing clear and culturally appropriate messages, selecting suitable communication channels, um, and then at the end, most important thing is evaluating what the campaign actually brings, like either there's a change in some knowledge, attitude, or behaviors. Next slide, Seher. So as we all know that awareness campaigns are important, and we also know that many diseases are preventable, yet people often lack knowledge, confidence, or feel important to protect their health. Cardiovascular disease is the best example because we all know many of major risk factors like smoking, physical inactivity, and these all factors are modifiable risk factors that can be easily preventable as well effectively managed as well. However, many people either underestimate their personal risk or are unaware of the importance of early prevention. So awareness campaigns basically bridge this gap. Through awareness campaign, we can increase public knowledge about disease, their risk factors, challenge myths, misconception. We can also reduce stigma associated with the illnesses, encourage early help-seeking behaviors, promote healthier lifestyle. And all these factors improve also their participation in preventive strategies as well. They can engage themselves in health screening, vaccination, or some other rehabilitation services. So beyond influencing individual behavior, awareness campaign also supports researchers by increasing community understanding of research. And that's the main point that we have achieved through our campaign as well. And with such initiatives, we can improve our recruitments in the studies. We can easily translate our scientific evidence into routine practice. And as well as we can inform policymakers as well through such initiatives. Next slide, Seher. Seher, the previous one. Previous one. Seher, your screen is not moving. Previous one, Seher. Previous one. I want that slide in which we quote some literature, like how these community events, the research paper. Yes, this one. So now I basically, why, like I already mentioned, like why such programs are important. So this is one of the community mental health awareness campaign run in India, in which they engaged 3,000 people in different locations. And as part of this program, when they look at the impact of such activities, uh, uh, they noticed that just because of this, more than 1,000 individuals sought mental health support. Many received preliminary diagnosis. Many people learned about mental health issues for the first time through this campaign. And they also, when I read this paper, they also mentioned that a lot of people approached mental health services after this campaign. So such activities not just improve their knowledge, but such activities also encourage people to seek care, reduce stigma, and improve access to health services. And similar findings have been reported in other papers as well, where different campaigns run promoting smoking cessation, physical activity, or cancer screening, and found as essential component for comprehensive public health coverage. Next slide, Seher. So for the key drivers, a lot of literature also talk about like what are the key factors if we want to create an impact through awareness campaign. We all know not every campaign is successful. Some campaigns fail because they assume that information alone is enough to change behavior. And some campaigns are not successful because they do not understand the needs, beliefs, and cultural context of their target audience. So research has shown that successful awareness campaigns share several important characteristics. And the first one is that every campaign should have a clear objective. We should know exactly what behavior we want to influence. Are we interested in encouraging people to to stop smoking, or opt healthy behaviors, or we want them to recognize early warning signs, or is there any other objective we want to deliver through such initiatives? The second important component of such to deliver an effective awareness campaign is all the material or the campaign must be culturally appropriate. Health messages should reflect local language and cultural values, literacy levels of the target population, as well as their community beliefs. A message that is effective in one community, also we should also know that a message that is effective in one community may not be effective for other communities. So we have to tailor all these campaign as per our target population. The third component is community participation. So community participation is essential. And for this, rather than designing the campaign all alone, it is recommended to engage service users at the initial level. All the service, the feedback from the service users found as essential in tailoring the awareness programs for the targeted population to make it more acceptable among the population. And the fourth important pillar or the objective is for the effective campaign is use of multiple communication channels. Like if we just rely on one communication channel, like we are just focusing on print media or just on social media, then it's not effective. So it should be through multiple channels to increase the likelihood that people will remember and act upon the information. And finally, every awareness session should include some evaluation strategy, either some pre and post assessments, just to assess the change in their knowledge or attitude or practices. Sehar, next slide. So for our across program, our main objective that for the Heartbeat of Pakistan that we run across Pakistan, our main objective is to raise awareness. We have a clear objective. We have an objective to raise awareness about cardiovascular disease by understanding their risk factors and warning signs, and also to inform them some early preventive measures, as well as another objective is to promote healthy lifestyle behaviors as part of preventive measures so that they can opt healthy behaviors beforehand and live an improved quality of life. Next slide. So for our Heartbeat of like the REACH program initiative, we approach different population across Pakistan. Because it's a nationwide campaign, we did number of activities in different provinces in Punjab, Sindh, Khyber Pakhtunkhwa, Balochistan, as well as Federal Capital. Next slide, please. As well as we engage diverse population as well as part of this campaign. We run number of sessions with the school teachers, healthcare professionals, medical professionals, nursing staff, frontline health workers, students, as well as at community levels as well. In different communities, we run this awareness campaign. Next slide, Sehar. And the most important or interesting thing that we observed is the roadshow that we run. In the roadshow, the large portion of the population that we approached were students and young adults. And this is particularly encouraging because existing evidence suggests that younger populations are one of the most important target groups for public health awareness campaign. Educating children, adolescents, and young adults at an early stage helps establish healthy behaviors before unhealthy habits become their routine part. It also equips them with the knowledge and skills to make informed decisions about their physical health, about treatment as well. Furthermore, it also improves or acts as an agent of change within their family and communities, because the child that then share that information with other family members. So it helps in bringing change at larger level. Next slide, Sehir. So our presentation covered three main areas. We talk about some prevalence at global, at national level. We also talk about the risk factors, the common risk factors of cardiac illness. We also talk about early prevention and some preventive measures. And we also talk about like the connection or the comorbidity of physical health, the cardiac health with depression and anxiety. Next slide, Sir. Also, the most important thing, as I mentioned before, for effective campaign, the content should be simple and in local language. So by keeping this thing in mind, we developed the PPTs in both English and Urdu, and in simple English and Urdu, and we run those PPTs with our service users groups as well to ensure that the content is comprehensive and understandable to all the literacy level population. And also we use pre and post assessment as well. We draft a 10 questionnaire, a simple like questionnaire, which simple questions about like what they think is the cardiac is an issue, what they think there is any link with cardiac illness as well as mental health, and we did pre and post assessment. Like we run initially and then we delivered the intervention, then we delivered the presentation, and then we ask again those questions to see is there any change or impact on the participant or not. Next slide, please. So now I'll show some brief slides like how we delivered. So these are the slides, some slides. Like we talk about the reason, we talk about the prevalence, and we talk about the risk of cardiac issue in adolescents as well as in other age group as well. Next slide. We talk about the four main important risk factors of cardiac illness, like unhealthy eating patterns, physical health, mental health, as well as substance use. Next slide. We also talk about early warning signs, like how they like if someone is feeling some changes in the body or some sensation, then how they should be like alert or visit a hospital ASAP. So we talk about some early warning signs as well, so that they can identify easily and approach care, mental health or physical health professionals. Next slide. We also talk about some preventive or healthy habits as well, so that they can try to follow. And then we also talk about the impact of those healthy routine and activities on their physical as well as their mental health. Next slide. These are we also developed some information brochures that we delivered or provide to the participants, display on our websites as well. We developed two kind of information. One is on physical health and one is on mental health. And that brochures include some key facts and figures, some risk factors, some preventive measure, some details about the project, our across project as well, so that they understand the importance of such research activities within community settings. Next slide, Sehir. And these all information brochures were discussed and approved by CIT members before we dispersed to the different stakeholders. Now I'm going to present some of our preliminary findings. As I mentioned that we did some pre and post assessment as well. Like how that some of the participant reports change, and there's some considerable change from pre and post findings. Sehir, next slide. So the first question that we asked in our awareness campaign is like, what they think about is that heart disease is the leading cause of death worldwide or not. Most of the people knows about this, but still there are some people who doesn't know about that it's a leading cause of death worldwide. Then we talk about the mental health conditions and its link with the heart health. again there are some people who don't know about this connection, and that's highlight a biggest gap. Like still there are some people who don't know that there's a direct connection of mental health and the cardiac health. Next slide. We also talk about like, do they think physical activity can improve their heart health and mental health? Though a lot of people agreed with it, but still again some people don't know about the importance of physical activity with respect to physical as well as mental health. We talk about smoking and unhealthy diet or the risk factors can increase the risk of heart disease. Most of the people agreed, and some there are some people who don't think that such unhealthy diet habits or activities can increase the risk of heart disease in them. So there are few people also. Next slide. And we also ask about, do they think mental health is as important as physical health? Again, most of the people agreed with it. Some very little people don't know that it's still important. Physical health is mental health is as important as physical health, but after the session there's an improvement, and in every uh, section of the question there is improvement with respect to their knowledge and attitude as well as the practice as well. Next slide, Seher. When we ask about like managing stress is an important for preventing heart disease, a lot of people agreed that it's important for preventing heart disease, but still some people don't agree. Some people are like rated as neutral, and some people majority agree with this, that it's important, and after the session there's an improvement in their attitude when we do the post assessment. Next slide, Seher. Um, we also ask about their attitude, like how they feel comfortable to discuss their mental health issues with their family, friends, and healthcare providers. Though we all know there's a stigma attached with mental health issues, so we ask this question as well. And though the lot of people agree, but still there are majority of people don't agree or don't feel comfortable in discussing their mental health issues when we do the pre-assessment. Next slide, Seher. And when we ask them about their physical activity, uh, then most of the people are engaged in physical activity, but like more like some people, like if we see that a lot of people are not engaged in physical activity, and even after the discussion or the presentation still when we ask this, there's either after the discussion of all these importance of physical activity, they want to engage in physical activity, but still there's a number who are not agree with this, like they will try or to engage in some physical activity like walk or exercise. And we when we ask about like, do they take some steps to manage stress, so some people rarely take some steps to manage their stress. And after discussing, though still there's some people who are not confident that they will take some steps to manage their stress, but still most of the people agreed that they try to manage or take steps like relaxation exercises or talk to someone to manage their stress. Next slide, Seher. And when we ask about like, do they take some information on cardiac health through internet or book, so very few people like agreed that they are do, but a lot of people do on occasionally basis, like they do learn about mental health thing or the cardiac health thing through internet, but still some people do on occasionally basis or need based basis. Next slide, Seher. Seher, next slide. Sehir?
Beta, we have the next slide. So what the roadshow achieved. Is that what the slide you're looking for?
I think internet has
So,
disconnected. No.
can you hear me?
Yeah, we can hear you.
Okay. So now, if we talk about like what we achieved through roadshow, the roadshow or this awareness campaign improves our cross-sector collaboration with different sectors like hospitals, schools, universities. This roadshow activity also help us in across work package one recruitment as well. Because a lot of people, when we visit community settings, a lot of people screened during these awareness sessions, which helps us in recruitment of our work package one. We, this roadshow also helps us in developing contacts within community settings as well, with health facilities as well, which can be a very important thing for future engagement and referrals as well. And as part of this initiative, we received request and interest. Like a lot of people during at the end of the session, they mentioned that they want same awareness campaign for adolescents as well. So now we are doing the same awareness campaign across Pakistan with adolescents. We are targeting schools uh, at different levels, like private and public both, just to raise awareness about cardiac health as well as mental health. Next slide, Sahir. So that's all from our awareness campaign. Thank you, everyone.
Good, Sarish. Um, Excellent presentation, and I think an amazing effort. So this number, Sarish, if I may ask a few quick things, is that
Yes, sir.
okay? So we in total we had 299 participants, or was the number bigger than this? 299 is only the number who participated the pre and post questionnaire.
The numbers are bigger than this, sir. The 299 are the numbers who completed the pre and post assessment, because when we run those session in community settings, like a lot of people like not participated in pre and post. So the number is larger than that.
Good. So what do we have any idea, rough idea of what were the numbers like? Can you hear me?
Because sir, yes, sir, I can hear you.
Yeah.
Second. So
Yeah,
the
go
numbers
ahead.
are quite big, because a lot of like in different settings, people not participated and if I of like those who not participated, is more than 100 people, sir, who are like attended those sessions but not participated in pre and post assessments, or or not able to like do the pre and post assessment.
Okay. Um, Rod has a question. Go ahead, Rod.
Thanks very much. Sehrish, again, congratulations. Really big effort and really interesting. So I guess I'm going to make a couple of observations and then perhaps I could ask a question. So I think this is very, very interesting. And I thought your last slide was really helpful, because it really asked the question for me of, what are we trying to achieve here? Because of course, across is really targeted secondary prevention. In other words, we identify people with existing cardiac mental health disease, and then we target our preventative strategies. But of course, what's very interesting from your presentation is many of those targeted interventions are identical in people who do not have existing disease but are at high risk of it. So that's the first observation. I think much of the resources we are developing in ACROSS, although we're going to trial them in patients with existing disease, I think as your study demonstrates, they can have wider benefits, particularly in as what we would call a primary prevention setting. So, to my questions. So the first one is just a practical one. Going back to Imran's question, of the population you recruited, do you have any idea how many had existing cardiac and a mental health problem? And then the second one is perhaps more of a challenging question, which is, how would you see us linking this with our ACROSS activity going forward, both in Pakistan and in Bangladesh? I think you've given us some very nice ideas that this may actually help improve community engagement, particularly in the sites where we're going to be recruiting to the trial. Yeah, I would be really interested, because I think this is a fascinating model, and yeah, what might be the benefits of trying to do this going forward, in addition to our more targeted approach that we will be doing through Work Package 2 and Work Package 3. Thank you.
Yes. So, like I mentioned, like people, this program helps in recruitment as well for our Work Package 1 as well. So what happened, or like once we complete the program, like participants came and discussed, like they know they can approach us through like this, and then we will screen them after this session. So though, but I don't have the exact numbers, like how many people are cardiac issue and mental health issue in those sessions, because we have not run screening of all the participants, because this program run across different population. We run with school setups, community setups, hospital setups, and frontline health workers as well. So that's the one thing. And regarding how it helps like in across project, like for Work Package 2 and 3, like you know, the research is not acceptable in LMICs. People hesitate in participation, they have some fears regarding the participation. So by engaging community at initial level, by developing context within the community, it helps in accepting those initiatives. So that's the most important thing, because if someone knows, like we are coming and they know, okay, we are mental health professionals and we are doing such activity, and it's there's no harm to participate in such initiatives. So it builds basically confidence in the community just to participate in such research. So that's why it's important, such kind of initiatives.
Very interesting. Yeah.
Thank you,
Yeah, because I think, Imran, trust, if I may, trust in these settings is absolutely crucial. And here maybe a sort of pre-intervention where we can gain local trust before we might formally go in and try and recruit into things like trials. Very, very interesting. I like that hypothesis, Sehrish. Back to you, Imran. Thank you.
Yeah, thanks. Mathila. Assalamu alaikum. Go ahead.
Assalamu alaikum to everyone. Thank you, Sehrish, for your nice presentation. It's really a good initiative, and it's a motivation for us to go forward with this type of approach. I'm just curious about one thing, that regarding NCD or any other chronic disease, we have the specialized physical activity instruction. So when I saw that there is a physical activity improvement after your this type of campaign, a significant number. I think that you told 3 days per week. So that's actually my question. So are we giving that just any type of physical activity, that is walking and exercise, just 3 days per week, but which is not the recommended level? So that's what I'm asking about, that approach should be recommended 5 days per week, or you already gave the information that 3 days per week is okay? And that's actually my question.
So basically, Mithila, in our pre-assessment, we ask about their like how they're physically active they are. Do they do some activities in last 3 weeks? So and if they do, so they just rate it like yeah, just say yes and no, and after the presentation, we ask them. Still, they know that it's important to be physically engaged. Now, what's their views? They are planning to do some physical activity. They are ready to bring that change in their life, and then we ask them like just mention yes, no, and still they are confused that they want to be physically active. So we ask them like this.
Yeah, okay, thank you.
Go ahead, Jamal, please.
Yeah, good afternoon. Cherish, nicely present. It's really very helpful for us. So my specific question on this, I am very curious about to know that the diversified group that attending this roadmap programs, but I am seems like it is a little bit missing that the religious leaders, as Pakistan is Islamic countries where they have a very good influence in this public and community level. So maybe religious leaders' engagement is a little bit missing. So is there any involvement was there? Just to know, or why this is,
Uh,
yeah.
it's always difficult to like call all the religious leaders at one point. So it's quite challenging because every institute have one or two religious leader, so it's difficult to call them all together. But it's an important point, Jamal, and we will make sure to conduct some activities with religious scholars as well in future.
I think Jamal, a very good point, because I think it'll enhance the endorsement and help with participation as well. And that is something we can do, Sari. So we will. A very good
Actually,
point.
you are planning to do this kind of community engagement involvement, and you know that the imam of this mosque, they are the in a sense of leader of this community. So we have a plan to engage with them. So that's why I asking them. This is really important to.
Important. I agree. I
Yeah,
agree. So,
thank you.
David, go ahead, please. And Rod, if I can hand it over to you for taking it forward. Okay, thank you. Go ahead, David.
Thanks. Yeah, so thanks, Sehrish. Great presentation and really impressive program of work. So yeah, well done to the whole team that are involved in that. I just wondered if you could say a little bit more about the next phase. You said you're targeting the adolescents. So I'm just wondering, like, would that be presumably through secondary schools? Are you thinking about doing that on a sort of similar scale? First question, and then second question is, do you anticipate there would be any tailoring of the sort of key messages for that age group? I'm thinking, in a UK context, certainly mental health would be a major issue for that sort of age group. It's a kind of escalating problem, really. So yeah, just interested to know what's coming next in a bit more detail.
So regarding our next steps, like with the Dolphin, so it's an ongoing activity, David. Right now, we are running this program, the same initiative with Dolphin as well. Though there is some summer break in Pakistan, so we will resume this initiative or such activities in August. But it's an ongoing. We have developed the PPT, which is more in simple language, so that students can easily understand and bring that information to their homes as well. So it's ongoing.
Okay, thanks.
Sorry, Dilip, I'm not doing my job. Dilip, please go ahead. Your hand's up.
Thank you, Rod. Serge, thank you very much for a very informative presentation. As from Rod's comment that this awareness was for a general population, but I think it will help us to, once we recruit a cardiac patient with any mental health condition. So because we all know that the changing health behavior requires a continuous education, repeated messages, and also a long-term community engagement. So I think that in the next step, once we recruit our patients, then that will help us to tailor this campaign and according to the patient's need. So do you have any plan to continue this campaign beyond the roadshow and monitor whether the participant actually adopt healthier behavior or like that? So
Again, Dilip, very important thing you mentioned. So we are planning to approach those institutes again after some time, because we have developed the connection with all those institutes through this program. But it's a very good thing. We'll try our best to go back and check again, is this that change still going on, or we need to do some other such kind of initiatives.
thank you.
Any other questions anyone has? I'm not seeing any hands. Give it a couple of seconds. Oh, well done, Carolyn. Good morning. How are things in Edinburgh?
They're very good. Thank you. Thank you. That was a superb presentation, Sehrish. I was wondering, it's the way that you're making all those connections and doing so much groundwork. And I was wondering whether I know you've talked about plans, but actually linking even further links with the across studies for maybe the feasibility studies from the findings of those, because that would maybe help increase motivation. I'm getting ahead of ourselves here, but making the link of those findings. So would you still be able to contact those people? You said you've made those connections. Is it still, you'd still be able to go back to those people that you've made those connections with updates of the study, the progress of these studies that we're going to be going into?
So we have established the contacts with those organizations. Carolyn,
yeah.
Can you hear me?
Yes.
So again, it's a very important point you mentioned, we should keep them, or we should think about how we can engage them, or will be helpful for feasibility studies as well. So we have established contacts, we have established contacts with the schools, we established contacts with nursing departments as well through this, so that they can we can approach them again for other initiatives, for other awareness programs as well, because we don't have the exact details of all the participants, their contact details, because as part of this project we have not as part of this campaign we have not took their contact details, but we have organizations details, we have institutes details who help us in conducting those activities.
Thank you.
Any other questions?
I have a question.
Go on, Plash.
Okay, it was an excellent presentation, Sehrish, and very good job. You did it. One of my query, that is the for both pre and post data collection, person was the same. Assessor was the same person for all 299 participants.
Sorry, Palash, if you can repeat your question.
Okay, my question was both pre and post data collection, the assessor was the same?
Yes. No, assessor were not the same. It was filled by the participants.
Okay, it was self-administered.
Yes, self-administered.
Okay, then fine. Okay, that's great. Thank you.
Okay. Okay. Well, I think if there aren't any other questions, first of all, huge thanks. Oh, Delete, you got in just before I was closing. Go ahead.
Sorry not to interrupt you.
No, go ahead, please.
So, if everyone would be happy to take a quick virtual photo before closing, so please switch on your camera for a
That's
moment.
a great idea. Yes, please. We are always looking for photographic opportunities, aren't we, Delete? So please put your camera on. Would you mind? I know some of you still haven't got your cameras on. You may be in your pajamas if it's UK time, which is a good excuse. Great. Is that enough, Delete? Does that give you enough faces?
Yeah. So that's it. Thank you very much.
Okay. So just as Dilip's doing the photo, I'll do a little bit of talking. So again, huge thanks, Sehrish, for a very stimulating presentation. I think you've provoked a lot of thought. I mean, one central observation I'm going to make is that I think these activities certainly could have really interesting value for our Across project in particular, such as you say, helping to recruit to the trial. And also Imran's comment about just improving local community trust in what we as a research group are. And I think that's a very interesting idea, and I'm sure others will take that away and think similarly. Another thought is I do think we've got a really nice opportunity to maybe, if you like, expand this activity on the 9th of September. We'll talk more about this, but 9th of September is the National World Heart Day. And this is exactly the kind of activity I think we should be planning on such a day. And I think, again, your model maybe gives us some ideas there. So maybe that's something we can specifically discuss, because we do want to do something this year around National Heart Day, which is the 9th of September. My last comment, Sehrish, is I'm always looking for research collaboration opportunities. And to David's point about, going into schools and targeting the message for adolescents, if you think about it, that's a really interesting and fundamental research idea, because if we can target these people early in their lives, we may be better to change behavior in a more sustainable way, and then really prevent some of the downstream problems that we then end up having to pick up in the Across programme. But of course, to confirm all of that would require a formal research evaluation. So as David knows, we've got at least one group in Glasgow who have done a lot of work around school-based interventions, primarily around, I guess, behaviour and negative sorts of behaviours. But it might be worth us thinking about linking, if you are interested, you with that group. It would be another separate research application, but of course we're always looking for opportunities, and maybe that might be one. And there may be others who are interested in that activity as well, but maybe thinking of a future research proposal, particularly around the school-based cardiac mental health well-being intervention. But of course, it would require some resources. So I might link you up with that group, Sehrish, and see if anything comes from there. Okay, so I'm about to close, but again, Amy, please come on in.
Sorry to sneak in at the end. It was just to say that was really interesting, Rod, and we will hopefully have our PhD student based in Peel joining early 27, whose focus is going to be on young people and adolescents. So that might link really very nicely with what you were just saying there.
Brilliant. I had forgotten that. So if that student is particularly working in this area, they could begin to do some of the foundational work that could actually be part of a larger bid later. So that's a great reminder, Amy. Thank you very much. So a real opportunity, I think, to leverage that activity, Sehrish, with your PhD student. Okay, well, I'm going to suggest that we close there. Thank you very much indeed, Sehrish. Great presentation, very stimulating. And just to say, we look forward to our next seminar. We'll probably need to identify some future speakers, but we will circulate those as soon as we can. Thanks again, everyone.